Hi, my name's Sarah Lehman, and today I'm going to be doing a thorough respiratory assessment on my patient Clara Lehman for my NU302 health assessment class. Claire is a 9-year-old female, and we're just going to go over her respiratory history right now. Claire, can you describe your overall breathing for me?
It's normal, and sometimes I wheeze.
Have you had any changes in the past 2 weeks?
No.
Claire, have you had any changes in the past 2 years?
Sometimes when it's cold out, I start to wheeze.
Are you having any shortness of breath right now?
No.
Any chest tightness?
No.
Are you coughing at all?
Every now and then.
Okay. Are you coughing anything up? Any mucus?
Mucus.
Do you know what color it is?
Like yellow.
Yellow? Okay. All right. Is it thick or is it pretty thin?
Thin.
Thin? Okay. All right. Are you having any wheezing right now?
No.
No. Have you been to the doctors lately? Like, have you been sick recently?
I've been sick, but I didn't go to the doctors.
Okay. All right. So you just have the history of asthma. Does anyone else in your family have any respiratory history?
No.
No. Okay. Do you take any medications for your asthma?
My nebulizer, inhaler, and
Do you take
nasal spray.
a nasal spray? Okay. Do you just take albuterol?
Yes.
Yes. Okay. All right. And did you get your flu shot this year?
No.
Okay. All right. Do you have any issues with your breathing at nighttime when you're going to sleep?
Sometimes, not all the time.
Okay. Do you just get a little congested?
Yeah.
Okay. Do you take your nebulizers before bed?
Yes.
Okay. All right. So this part of the assessment, we're going to be just doing inspection. So I'm going to just observe and look at Claire's anterior and posterior sides of her chest. We're just going to be looking at breathing, skin color, and we're just going to go along down the posterior and anterior of the chest. Okay, so Claire has a really good posture. And her chest is symmetrical on each side compared to her abdomen. There's no barrel chesting. Clavicles meet symmetrically, and her trachea is midline, so it shows she has no tracheal deviation, meaning that one side of the lung is not being compressed versus the other one, and that there is no chest trauma. Her skin is nice and pink. Looks like blood flow is going really well. If I look at her cap refill, the blood returns less than 3 seconds, which is really good. Her nails are really thin, and there's no clubbing noted. And there's good hair growth up the arm, letting us know that the circulation is really good to the skin. And she's not using any accessory muscles when she breathes. So her respiratory rate seems to be between 20 and 22 breaths per minute, which is really good for her age. And then if I look on her posterior chest and anterior chest, her chest walls are rising and falling equally, so it shows that she has no respiratory distress, there's no trauma or compression on one side, and it lets us know that both lungs are inflated and that there's no injury or illness preventing the chest to expand completely. And I do not notice any shortness of breath. I'm not hearing any wheezing at this point. And we're going to move on to our palpitation part of the assessment. I'm just going to be feeling over top the front and back of your chest. We're going to be feeling for any dullness noted over your chest, which would suggest that there is a lot of mucus inside your lungs. And we're also just going to be feeling to see if there's any abnormal lumps or bumps noted on either side, okay? Are you okay with that?
Mm-hmm.
Okay. Alright, so we're just gonna feel around here. Make sure we don't have anything abnormal going on, okay? Move on to the back. can you lean forward for me? Okay. Okay. Did you have any tenderness or pain while I was palpating your chest?
No.
No? Okay. I didn't feel any dullness, didn't feel anything abnormal, okay? Okay, so after palpating, I'm just gonna, if you can turn this way, swing your legs that way, I'm gonna place my hands around your sides and then on your back. And from my point of view, I'm just gonna be looking to see if your lungs are expanding equally, and my fingers will move at the exact same pace, okay? Okay. My arms have been moving and my thumbs have been moving equally. Just gonna check at this point too. Just give me some normal breaths, okay? Okay. It seems like everything, your diaphragm on the left and right side, each lung is inflating equally and the chest is rising perfectly, okay? And at this point, we're going to move on to the percussion part of the assessment. So for this part of the assessment, I'm going to be percussing her chest. I'm just going to lightly tap over the anterior and posterior side of the chest. And right now, we're just feeling for any dullness noted over throughout the lung fields, okay? So I'm just going to lightly tap. And if you can turn around for me, I'm just going to do the exact same on the back. Okay, and now we're going to move on to the auscultation part of the assessment. For this last part, I'm just going to be listening to all the lung fields with my stethoscope. I'm just, again, going to first listen to the front part of your chest, and then I'm going to move around to the back side of your chest, okay?
Yeah.
And you can just breathe normal for this, okay? And while I'm auscultating, I'm just listening to see if I can hear any adventitious lung sounds. Anything abnormal such as crackles, wheezing, any stridor, or bronchi. Okay, Claire, you can go ahead and take a seat for me. Everything sounded great. For the last segment of the assessment, I'm going to be assessing Claire's voice. The first part we're going to do is bronchophony. So I'm just going to lay my hands on the back side of your chest. And all I need you to do is say 99 whenever you hear me move my stethoscope, okay?
Mm-hmm.
Can you do that for me?
Yes.
All right, go ahead and turn around for me.
99. 99. 99. 99. 99. 99. 99.
Okay, we're going to move on to the second portion of the voice assessment, okay? So for the second part of the voice assessment, we're going to test your egophony. So just like last time, whenever you feel me move my stethoscope, I need you to say E this time, okay?
Mm-hmm.
All right, if you could turn around for me. It's pretty simple, okay?
E. 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 E.
Okay. For the last segment of the voice assessment, we're going to be doing whispered pectoralquy. So what I need you to do is, like last time, I'm going to place my stethoscope on your back. I just need you to whisper 1, 2, 3, okay?
Okay.
So this ends our respiratory assessment for Claire. So Claire, thank you.
You're welcome.
And everything sounded good, okay?
Okay.
All right.